Good morning, everyone. We're from SGDB7, the fourth semester of PSSK 2021. Today, we will present our student project presentation, which title is Caffeine in Coronary Artery Disease. Next. These are our members. Next. So now I'll explain the introduction. Next. Good morning, everyone. My name is Ledwin Meikel Wibisono with the last three digits of student number 061. And now I'll explain about the introduction of our student project. So caffeine is the world's most widely used hypostimulant and is widely available in regular beverages such as coffee, tea, energy drinks, and other food products. And approximately caffeine is consumed by 90% of adults of all worldwide, and the highest consumer is around 50 until 64 years old. And caffeine is an alkaloid and considered the most abundant metal xanthine in foods. It has both beneficial and negative impacts on the human body, and its action affects a range of systems such as the central nervous system, cardiovascular system, immune system, and other systems in the body. And these effects vary according on the amount, the type of product containing caffeine, and the individual characteristics. And coffee consumption in moderation, around 300 until 400 milligrams per day, regardless of source, is considered safe by the European and American health authorities, and is not related with negative impact and cardiovascular impacts. And however, overconsumption of caffeine can increase the risk and lead to a serious cardiovascular disease such as coronary artery disease or CAD. CAD is one of the most prevalent cardiovascular disease, and approximately 126 million people worldwide is affected, and in Indonesia in 2018 occurred in 1.5% of the total population. And CAD is often associated with several factors. One of them is the excessive amount of consumption of caffeine, more than 400 milligrams per day. And one of the possible mechanisms of caffeine is reducing the ability of the coronary arteries to improve flow in response to the increased myocardial demand, thus leading to CAD. And based on the urgency and the background above, it is very important to know more and comprehensively about the association of caffeine intake and CAD. That's all from me. Thank you.
Hello everyone, my name is Natania Sutedja with the last digit of student number 175. Next. Okay, so the problem formulation for the student project is what is the definition of caffeine and CAD? What is the method of journal searching? What are the associations between caffeine and CAD? What are the digestion and absorption of caffeine? What is the RDA of caffeine? What are the possible risks related to nutrition problem might develop? And what are the nutrition approach to help solving the problem? Next. And to understand the objective of the student project is to understand the definition of caffeine and CAD, to understand the method of journal searching, to understand the association between caffeine and CAD, to understand the digestion and absorption of caffeine, to understand the RDA of caffeine, to understand the possible risks related to the nutrition problem, and to understand the nutrition approach to help solving the problem. Next. As for the benefit of this student project is this paper can be used for educational and teaching resources, practicing and developing skills to conduct research, improving literacy skills by researching through dozens of journals. And for the institution, we can add the educational material, particularly on this topic, adding the sources of knowledge, and can be used as reference to conduct research. And for the public community, we can introduce and educate the public about caffeine and CAD, increase the public awareness about caffeine and CAD, and as a reference or guide to know more about caffeine and CAD. That's all from me. Thank you very much.
Thank you for the opportunity. My name is Jennifer with last three digit of student number is 101. Next, now I'll talk about the definition of caffeine. Caffeine is one kind of psychostimulant in the metal xanthine class that inhibits adenosine binding by attaching to adenosine receptors in the central nervous system or CNS. As a result, the medullary, vagal, vasomotor, and respiratory center in the brain are stimulated, preventing the adenosine-mediated downregulation of CNS activity. The stimulant will affect the body through rapid breathing, increase pulse rate and blood pressure, and diminish fatigue. The effect will be depend on the amount that is ingested and the tolerance of each individual. Caffeine also occurs naturally in some types of coffee and tea, some types of tea and cocoa beans, but this stimulant is most frequently derived from coffee beans. Although preventing weariness and sleepiness is the main reason to consume caffeine, there are many other benefits as well. For example, caffeine is utilized in several painkillers and cold medicine that also contain substances that often make people drowsy as well as wake-promoting compounds. That's all from me. Thank you.
Hey, good morning. My name is Krishna Putri with last digit number 027, and I will explain about the definition of CAD. So coronary artery disease, or CAD, is a heart condition in which inadequate supply of blood and oxygen to the myocardium causes a mismatch between oxygen supply and demand. It is commonly caused by occlusion of coronary arteries due to formation of atherosclerotic plaque inside the lumen of arteries that supply the myocardium. CAD accounts for approximately 17.8 million deaths annually and is the third leading cause of death worldwide. Hypertension, hyperlipidemia, excess body weight, diabetes mellitus, tobacco smoking, poor diet, and sedentary lifestyle significantly increase the risk of developing coronary artery disease. This risk factor promotes formation of atherosclerotic plaque in the lumen of arteries. Progressive increase in size of the plaque and thickening of the inner layer of coronary arteries leads to gradual narrowing of the lumen that impedes blood flow and oxygen supply to the myocardium. These narrowed arteries cannot sufficiently supply myocardium with oxygen, especially during physical exertion in which oxygen demand is increased, leading to stable angina and acute coronary syndrome. That's all from me. Thank you.
Okay, let me introduce myself. My name is Satya Wijaya with last digit of student number 27. And I would like to explain more about the method that our group used to search for appropriate references in making our student project. Next slide, please. Okay, so the references and data for our student project were obtained from 3 online scientific journal databases, specifically Science Direct, PubMed, and Google Scholar. The keywords used in the search were adjusted according to the medical subject heading and comprised of caffeine, coronary artery disease, recommended dietary allowance, digestion, absorption, nutrition therapy, and nutrition disorder. Selectively chosen and combined with the use of Boolean operators such as and as well as or, depending on the specific needs of the student project. Additionally, the inclusion criteria used in our method are 1. Publications in a range of the last 5 years from 2019 to 2023 for scientific journals, and 2. Use English or Indonesian language. Meanwhile, the exclusion criterion is 1. Journals without an international standard serial number or digital object identifier. That's all from me. Thank you.
Good morning. My name is Gregorius Thongiratama with the last digit of student number 085. Now I'm going to explain about the association between caffeine and COD. Caffeine could be metabolized starting from absorption with concentration peaks 1 hour later with 6 hours of lag. Caffeine as xanthine derivative could interact with hydrophobic residues and activate the nicotine receptor isoforms, increasing calcium ion sensitivity. Caffeine's effect involves the sympathetic nervous system in engaging cardioprotective effects against coronary artery disease or CAD. Caffeine's impact is related to orexinergic neurons, adenosine, and dose-dependent, which proper dose of caffeine could act as an antioxidant and decrease the risk of heart failure. But on the other hand, excessive caffeine consumption could lead to a pro-oxidant effect that causes DNA damage mediated by copper ion reduction. All from me, and thank you.
Good morning, my name is Marta. I'm a digit of student number E064. Now I'll talk about the digestion and absorption of caffeine. So oral absorption of caffeine is very rapid and complete. Plasma concentrations reach a peak within 15 to 120 minutes after oral ingestion. The absorption and metabolism of caffeine for each individual is different because it's influenced by several things such as gastric emptying time and the presence of other food elements. Caffeine that is absorbed into the bloodstream through the stomach and small intestine will be carried to the liver as the main site of caffeine metabolism. And caffeine is exclusively metabolized by cytochrome P450, with the main reaction being the demethylation of caffeine. Caffeine didn't show a significant first-pass effect. Most of the caffeine is excreted from the body through urine. Caffeine is easily reabsorbed by the kidney tubules, so only a small amount of caffeine is excreted in unchanged form through the urine. That's all from me. Thank you.
My name is Ariela Rahardjo with last digit name 247. Next. Now I will continue the explanation about digestion and absorption of caffeine. So caffeine can also have an impact on the absorption of several nutrients such as calcium, iron, magnesium, and vitamin D. First, calcium. Caffeine can interfere with the normal absorption of calcium in the body and reduce the amount of calcium that is being absorbed by the intestines and can have negative effects on bone health. The next one is iron. Caffeine can impact the absorption of iron in the body. Iron is an essential mineral that is needed for healthy red blood cells which carry oxygen throughout the body. As a result, regular consumption of caffeine may lead to iron deficiency anemia. The third one is magnesium. Magnesium is one of basic essential nutrients in the body. Magnesium deficiency is badly observed as a result of caffeine consumption. Magnesium deficit is involved in addiction to various addictive substances to include caffeine, and one of the main side effects of consuming too much coffee is frequent urination. Therefore, magnesium depleted easily and quickly. And the last one is vitamin D. Coffee inhibits vitamin D receptors on osteoblasts, the cells responsible for producing the bone, which limit the amount that will be absorbed. As vitamin D is important in the absorption and use of calcium in the building the bone, this might cause a decrease in the bone mineral density and increase risk for osteoporosis and fracture. I guess that's all for me. Thank you.
Okay, thank you for the opportunity. My name is Wilbert Purnamsidi with last three digit of my student number is 135. And now I will explain about recommended dietary allowance or RDA of caffeine. Okay, so United States Food and Drug Administration or FDA give us recommendation that RDA of caffeine is maximum is not more than 400 milligrams or of caffeine in a day. Why? Because if we take more than 400 milligrams caffeine a day, we can have side effect of caffeine such as headaches, trembling, heart palpitations, feeling restless, feeling afraid, mood swings, and even suicidal thought. And another research, another journal give us conclusion that consume caffeine about 200 until 400 milligrams per day can give us benefit to our heart, that caffeine can reduce the number of segments with reversible defects detected by regeneration stress myocardial perfusion imaging. So now the question is, how much is 400 milligrams of caffeine? So 1 cup of coffee with 8-ounce serving size is contain about 80 until 100 milligram of caffeine. That means in one day, we can drink about maximum about 4 until 5 cup of coffee. Maybe that's all from me. I give it to my friend. Thank you.
Hello, my name is Devi Prastiti with last 3 digit number 028, and I would like to tell about the risk related to caffeine that might develop. So firstly, overconsumption of caffeine could cause headache and migraine. Caffeine causes a loss of magnesium through the urine, possibly by inhibiting its reabsorption. And by having a decreased level of magnesium, which affects the nerve transmission, caffeine may cause headache. And caffeine also contains an enzyme called thiaminases that works in making persistent migraine. Besides that, overconsumption of caffeine could affect reproduction. Caffeine use while pregnant might have a negative effect on the development of the fetus. Through the inhibition of phosphodiesterase, caffeine may interfere with embryonic cell growth and development. In this case, excessive caffeine use may make children more prone to seizures. That's all from me. Thank you.
I will continue the presentations. My name is Felix Djuanda with release digit 117. I will explain about the nutrition approach to help solving the problem. The first one we can do is sodium restrictions. Sodium restrictions can help to reduce the blood pressure and reduce hypertension. It's also recommended to do fluid restrictions if the patient have hyponatremia. And then we can do healthy diet with more plant-based food rather than the animal derived food. The example of diet pattern we can use is Mediterranean diet and the DASH diet.
My name is Ayu Karralika Raidinjana with the last digit number 246, and now I will continue the explanation. Next slide, please. So the next step in the non-rigid approach is the replacement of saturated and trans fat. The reduced intake of saturated fat or trans fat and replace with polyunsaturated fat can reduce low-density lipoprotein or LDL cholesterol by as much as 0.05 millimole per liter. And the next step is the reduction of cholesterol consumption, and where the current AHA or ACC guidelines recommend healthy dietary patterns low in cholesterol to achieve cardiovascular health, where dietary cholesterol is found not to have positive connection with risk of cardiovascular disease. That is all from you.
Okay, so my name is Kusuma Mulya with the last three digits of student number is 151. Here I would like to present the conclusion, the last chapter of this presentation. Next slide, please. So we go for the summary of this presentation. Is Kevin is a stimulant that can increase breathing, pulse rate, and blood pressure while reducing fatigue. It acts by stimulating neurons and preventing the inhibition of certain brain cells, potentially leading to conditions like coronary artery disease or CAD. Excessive caffeine intake can interfere with the absorption of important nutrients and may cause side effects such as migraines, chronic pain, and increased risk of seizures. However, when the caffeine is consumed within the recommended limit of 400 milligrams a day and alongside with a healthy diet, caffeine is generally considered safe. Next slide, please. So I would like to give you a summary of a healthy diet is sodium restriction, replacement of saturated fats and trans fats, and cholesterol reductions. So we go to the last slide of this presentation is recommendation. So we could recommend that while moderate caffeine consumption is generally safe for individuals with CAD, it is advisable to limit intake and focus on other preventive measures such as regular exercise, a healthy diet, and medication adherence to reduce the risk of complications. That's all from our presentation. Thank you so much and have a good day.